So I chose for my final project polycythemia vera. So now I'm going to tell you all about it. First, what is it? What is polycythemia vera? Polycythemia vera is a condition in which the JAK2 gene, short for Janus kinase, starts to mutate, causing an overproduction of red blood cells. According to the Mayo Clinic, polycythemia vera is a slow-growing blood cancer in which your bone marrow makes too many red blood cells. These excess cells thicken your blood, slowing its flow. They can also cause complications such as blood clots, which can lead to a stroke or heart attack. Some of the signs and symptoms include fatigue, itching all over the body, sweating, painful bleeding or numbness in the hands and feet, bleeding from the gums, and heavy bleeding from small cuts. So what are the stages of the disease? There are really no specific stages for the disease. I do know of an instance where a person came into the hospital and was complaining of pain in her leg. They did some tests and found out that she was having a clot. So further workup led them to believe that something else was going on, and that's when she found out she had polycythemia vera. But it is manageable with treatment. So according to the National Organization for Rare Disorders, there is kind of what's called a spent phase. It's called a polycythemia vera, in which the bone marrow no longer produces healthy functioning blood cells, and they may require periodic blood transfusions to maintain sufficient levels of the blood cells. During the spent phase, the spleen may become significantly enlarged and painful, potentially requiring its removal through surgery. But as far as I found, there were no specific stages of the disease. What is the severity to classify the disorder? I didn't really find any severity to classify. The only thing, the research I did was it's manageable. It's a manageable disease if followed by your doctor. However, if it's left untreated, polycythemia vera can be fatal. Research has found that 1.5 to 3 years of median survival in the absence of therapy has been extended at least to 10 to 20 years because of new therapeutic tools. So who gets the disease? So anyone can get it. However, adults 60 or greater are more likely to develop the disease, and it's extremely rare in individuals less than 20. Women are more likely to develop the disease than men. Ethnic groups, PV is more prevalent among Jews of Eastern European descent than any other European or Asians. Here's kind of something interesting I found. I guess there was a cluster of people in 2008 from the northeastern region of Pennsylvania. So did a little research, and it said it was possibly exposure to radon gas, but that was never confirmed. So the Agency for Toxic Substance and Disease says that there was not confirmed, and it was based on a lack of additional information, and that's pretty much as far as I got with that. And it is not genetic. However, if your family has a history, you should be tested. So how do you make a diagnosis? So your physician will order what's called a CBC, or a complete blood count. It's taken from a venous draw. And they might also order an H&H, which is hemoglobin and hematocrit. And some of the things that they would look for whenever they got your labs back would be an elevated white blood cell count, an elevated red blood cell count, and then also your platelets will be elevated. And then if you have those three things, then there might be a suggestion of polycythemia vera. In patients that have a more advanced part of the disease, they might require a bone marrow biopsy to see if the test will determine if the bone marrow is functioning properly. So here's something I found from the diagnostic criteria from the World Health Organization, and you can see here it gives the elevated hemoglobin, elevated hematocrit, how your red cell mass will be affected, evidence of erythrocytosis, and the presence of the JAK2 gene, which I mentioned earlier, the Janus kinase gene, which will cause to mutate. So if you were a hematologist or you worked in the lab and you're looking in your microscope and you want to know what it might look like, this is what you would see if you did a bone marrow biopsy and then you took the cells from the bone marrow and you mounted them on a slide. So this is a picture of what it would potentially look like. So how is the disease treated? It's treated through phlebotomization. So that's kind of like, I would describe it as giving blood. So what they would do is they would pipe off some of the extra red blood cells that you have to kind of create a sense of normal for your body. So this would decrease the number of red blood cells, and this process is called venesection or venesection. So another drug used to treat this sometimes is called hydrea or hydroxyurea, and it can be used on patients that need it, but not everyone needs to be on extensive medication for this disorder. Oh, one more thing, and they also recommend that low-dose aspirin is used to decrease the risk of clot formation, or if you have high uric acid levels, you might take something called allopurinol. And antihistamines or ultraviolet light therapy to help treat severe itchiness. And some doctors may even suggest tanning bed to relieve the itchiness because of your exposure to ultraviolet light. So, future of the disease. So they've done some clinical trials on a medication called Gleevec, and it has been successful in treating individuals with MPNs or PV, and so more long-term research or effectiveness is needed to study up on this. So these are my references, all right here, and this little link right here is the 1, 2, 3, 4th one down. It gives a really good rundown of the disease. Thanks for watching.